Well, data experts tell me in recent weeks, COVID-19 case increases are switching spots. We're now seeing decreases among college-age kids, those 15 to 24, but slow and steady upticks in other age groups.
A week or two ago, we started seeing more patients in our ambulatory clinics with COVID-like symptoms, and we started diagnosing it more than we had noticed in the prior month.
Andrew Carroll is a family doctor in the Valley, treating not just COVID, but complacency.
One person who didn't think that she had COVID because it was, more mild symptoms. And since the news had been that COVID was pretty much almost gone in our community, didn't really mind it much. But then 6 days later, she came in to see me and she ended up being positive. Well, she's been hanging out with her family of 10 in their home.
That's one case, but data experts say cases have seen a steady uptick in recent weeks.
Case counts were really driven by college kids and other young adults, and now we sort of have proportional growth in all age demographics. And what that means is that now we're just getting this slow burn increase.
Data from the state dashboard appears to show steady upticks in COVID-19 hospitalizations, but as you can see in the graph, far lower than the summer peak. University of Arizona professor Dr. Joe Gerald believes there's a data reporting issue that's reflecting the uptick, but says he is keeping his eyes on cases.
We're poised like a cocked gun. We're ready to go off. We just hopefully can avoid whatever triggers that increase.
Gerald says we are still in a reasonably good place, but in his weekly modeling report notes mitigation efforts like masks and distancing are key. He also points to a rise in a value called R0, which measures the rate of transmission and often cited by the governor's office. It rose back above 1 starting last month, indicating the virus is spreading. But Gerald says we don't have to bank on a second surge.
How we choose to behave is going to be how the virus responds. And so we have some agency here. We can control our own destiny. And so I hope we don't need to keep our fingers crossed. Instead, we should keep our sleeves rolled up and continue to do the hard work that's necessary to keep this virus in check.
And they all send the reminder, flu season won't make the fight any easier. Mike Pelton, ABC15, Arizona.
At least 6 states in Washington, D.C. say they want to review any approved COVID-19 vaccine on their own. New York and California say they've already convened expert panels for that purpose. They've cited concerns about political interference by the Trump administration in the approval process.
It's not a good idea for individual states to make their own decisions. This is a national public health emergency. And, if it's approved or not approved, states really shouldn't be taking it into their own hands.
That's Lawrence Gostin, director of the World Health Organization's Center on National and Global Health Law. He says states don't have the power to grant or remove a vaccine approval. Congress has designated that sole authority to the FDA. Gostin says the role of the CDC will be interesting because they're supposed to advise states on science-based policies, and the federal government cannot force state public health agencies to distribute a vaccine.
Individuals in that state could still get the vaccine in other ways through their doctors, their pharmacies, but state public health departments just might say, no, we're not cooperating.
Gostin says the FDA commissioner has assured him the process will be safe. Earlier this week, the agency said manufacturers will need to follow strict guidelines that would make it unlikely to get approval before Election Day. Still, the Secretary for Health and Human Services does technically have the power to approve a vaccine over the head of the FDA commissioner. But Gostin says that would cause public trust to plummet even further. New virus cases are trending up in about half of the country. Only a few states are seeing the infection rates drop. Even more concerning is that several states are also experiencing record high hospitalization rates. This is according to the COVID tracking project. Nationwide, cases are up about 6% compared to the week before.